General practice has been at the heart of the NHS since it was formed over 65 years ago. The UK Family Doctor Service is admired around the world for its cost-effective provision of locally accessible, high-quality care. And doctors remain our most trusted professionals. However, the environment that GPs are striving to provide services in is increasingly challenging. GPs from across the country are telling us that they are firefighting to provide the services that their patients want and care that they are not always able to do so. In some areas of the country, patients are not always able to get an appointment when they want to see their GP. In 2013, the Royal College of General Practitioners estimated that 26 million people waited more than a week to see their GP. In England alone, NHS England estimates that at least 340 million patient consultations are undertaken every year, and this is up 40 million since 2008. The average person visits their GP practice 6 times a year. It is estimated this is double the number of visits from a decade ago. The number of elderly and vulnerable patients, the heaviest users of the NHS, continues to increase. By 2011, the number of people aged over 65 had reached 10.5 million, and by 2031, the NHS Confederation predicts that this figure will reach 15.5 million. These patients and their family need more time to talk to their GP practice team to plan their care. The 10 minutes available to these patients in a standard GP appointment simply isn't long enough. More care for patients with chronic diseases, such as diabetes and asthma, previously carried out in a hospital setting, are now increasingly being provided through GP services. The government also wants more patients to be looked after at home or in a community setting, further raising demand for services. Demand for GP services in some areas of the UK simply seems to have outstripped supply. Based on the current number of doctors working as GPs and the staff who support them, there are just not enough hours in the day to meet everybody's needs. GPs are telling us that they are struggling to recruit the vacant posts in their practices and to find locums to cover, so patients can still be seen if a colleague is sick or absent. Even if more GPs were recruited, trained and ready to see patients tomorrow, there would not be enough physical space available for them to work. Many practices are old and need investment to create more rooms for clinicians to see their patients, or simply make them fit for purpose. They need to have the right facilities to support the delivery of flexible, community-based services that local patients need and practices are being asked to provide. The increasing demand and workload pressures are leading to low morale and stress, causing GPs to leave the profession or consider retiring early. GPs and their practice teams must have greater support to deliver high-quality services that meet the requirements of all their local patients. That is why the BMA has launched a campaign in support of GPs and their practice teams, and together with our members, we are calling for sustainable investment to be made in GP services throughout the UK. This must include long-term sustainable investment to attract, retain and expand the number of GPs, long-term sustainable investment in the wider practice team to meet the needs of patients, and long-term sustainable investment in GP premises and the facilities they are able to offer. Your GP cares about the current situation and wants it to change. GPs and the whole practice team want to work with patients and the government to find real solutions to fix the current problems facing GP services for the long term and to provide a better service for the future. Show your support for your local GP surgery by joining our campaign so that government understands the urgent need for long-term, sustainable investment in GP services for today and tomorrow.